welcome to Friday's One Change Away interview with Dr. Sam Madeira. Today we're going to talk about the number one mistake people with thyroid issues make. And many of you know, a lot of you know me personally, not a lot of you don't. My name is David Bennett, and we are here to talk to an expert on hormone issues, Dr. Sam Madeira. Dr. Sam is a well-known expert on thyroid and hormone issues. He is a naturopathic doctor, practices out of Seattle. I had posted his bio previously. He was the 2019 Seattle's best naturopathic doctor, voted for by your colleagues, I believe.
Yeah. Yep.
Awesome.
By other naturopathic doctors, chiropractors, etc.
Awesome. So we're going to talk about a lot of things with thyroid. We're going to try to keep it to the point. If you have questions, please put them in the chat box. I will try to field them now, or we'll field them after. So we'll jump right in. My first set of questions, Dr. Madeira, Dr. Sam, which do you prefer? How's that? That's the first
Dr. Sam's good. It's Friday. I think we can take it down a little bit. Yeah.
Tell us a little bit about your background experience, and particularly tell us what a naturopath is, because I get that question a lot. People get confused, so let's clear it up right off the bat.
Sure. Naturopathic doctors have actually been around for probably over 150 years now. We look at identifying the root cause of illness, assuming that you're working with a naturopath who's been trained to do that. We basically trademark the therapeutic order. So that's using the least invasive treatment first. And if along with lifestyle, diet, nutrition, etc., herbal medicines, sometimes homeopathic medicines, if the naturopathic doctor's been trained in those things. In certain states, we have prescription rights, or we're basically seen as primary care physicians, like here in Washington State and here in Montana State, where I am right now. Excuse me. And, we look at removing obstacles that are in the way of people healing. So that can be sometimes their job, or it could be like specific medications that they're taking that are interacting with each other. Stimulating their own self-healing mechanisms. So you can use different therapies to do that, whether it be nutrition, IV nutrient therapies, hydrotherapy, etc. Really strengthening the weakened systems in the body. So usually there's excess and deficiencies in the body, which we all can kind of agree on, right? Correcting structural integrity. So that comes from maybe chiropractic manipulation, similar to that. We learned some manipulation in school as well. And I personally did actually extra training in physical medicine, as well as craniosacral therapy, using natural substances to heal the body, help the body restore and regenerate. So that can be like herbal medicines. We're talking about thyroid today. So an herbal medicine that's used for a lot of hormone health conditions like thyroid is ashwagandha. So that would be an example there. And then if somebody needs pharmaceutical interventions, hopefully it's for a short period of time, we can prescribe those. Maybe they need an antibiotic or something like that because they got so sick. And then you're using herbal medicines and hydrotherapy and other things to help them heal at the same time. And if they need more like high force modalities, invasive procedures, then it's like, okay, now you need surgery. We've done everything else we could. Now it's time for you to get maybe a second or third opinion to see what kind of surgery, but surgery is the best thing for you to get, as an example. So that's kind of like the therapeutic order in naturopathic medicine in a nutshell.
Awesome. So I was looking away, and I was actually paying attention. I had to make sure I could see the comments in case somebody had a question. So
no worries.
Tough problem. So let's just jump right in because we have a limited amount of time. Those specific mistakes when it comes to thyroid issues, could you just give us a little bit, like the number one mistake that people make with thyroid issues or discovering thyroid issues?
Yeah. So The number one thing that I think both of us and our other colleagues in the naturopathic medicine and functional medicine space see over and over again is people aren't getting the correct labs done. So if you don't diagnose it, then you can't treat it correctly. And diagnosis always comes first. We don't want to put the cart before the horse, so to speak. So if you're just getting a TSH and a T4 done for your blood test with your primary care physician, then we don't really know what's going on with your thyroid. So you need to get TSH, you need to get a free T4, total T4, free T3, which is your active form of thyroid hormone, which all of your cells are more sensitive to T3. It also has a shorter half-life. What does that mean? That means that it's going to go away quicker in your body. T3 is like the RPMs in your cells spinning out your ATP in your mitochondria. So if you have...
Okay, I'm going to go time out here for 1 second.
Yeah, sure.
What's the ATP?
ATP is cellular energy. So maybe some of you will have to kind of like dust off your high school biology textbook if you still have one, but you can Google mitochondria ATP. And mitochondria are like the coal powerhouses of your cell. So we make our own cellular energy every day, and that comes from our food. So it comes from, if you're eating a balanced diet and you're not on some like very strict diet, then you're getting it from your fatty acids from fats, you're getting it from your glucose from carbohydrates, and you're getting it from amino acids from protein. And then your cell pushes those different substances into the mitochondria through different shuttling processes. And then your mitochondria, if they're working correctly, which most people's aren't, which would be a whole other topic, make cellular energy. So there's a certain amount of cellular energy you can make if everything's working correctly. And if you don't have adequate active thyroid hormone, T3, and the 3 stands for how many iodine groups are in this thyroid hormone. So there's 3 iodine groups in T3, there's 4 in T4. And then the other part so we have for your lab test, TSH, thyroid stimulating hormone, which is actually a brain hormone coming from your anterior pituitary gland, which is
And
part
I'll
of your
list these
brain.
in a document and post them with this so that everybody doesn't have to write it down. You're also going to have me, I'm going to interrupt Dr. Sam because Dr. Sam and I are going to start, he and I will nerd out, I'll say, on some stuff. And I'm going to try to bring it down to a level because everybody may not get the terms that are being thrown around. And if you don't understand the term or want more explanation, write in the comments. We'll try to follow it up. So, let's run
so
to
recap, the labs that you should be getting that you're probably not getting unless you're working with a functional healthcare practitioner or naturopathic physician are TSH, which is a brain hormone, telling your thyroid to make T4. So your thyroid glands in your throat. That's why I'm pointing to my throat. Then T4, total and free. And then T3, total and free. And then your antibodies. So you need to look at antibody counts and reverse T3. So antibodies can tell us if you have autoimmune thyroiditis that is causing low thyroid function and autoimmune thyroiditis that is causing high thyroid function. And if you have Graves' disease, which is the high thyroid function, you're going to have symptoms like rapid heart rates. You may wake up in the middle of the night with a rapid heart rate, and that's problematic because if that happens a lot, you could throw a clot. And if that clot gets lodged in blood vessels in the brain, then you can have a stroke, or you can have heart problems or you can have other issues. So, excuse me. So that's an issue that usually is treated with medication from an endocrinologist with Graves' disease, which is high thyroid function. More commonly, what we see is Hashimoto's thyroiditis, which is low thyroid function. So Hashimoto's is where your antibodies are attacking the thyroid gland, and then the thyroid gland eventually is actually getting destroyed, and you have less and less thyroid to make thyroid hormone. and you feel very fatigued. You may have cold hands and feet, constipation, similar to low thyroid function, but it has an autoimmune disease cause. So if you're not testing antibodies, which most primary care physicians today, nurse practitioners and medical doctors are not testing, and why they're not testing it is because your insurance will not cover a condition to get diagnosed. They will only cover it once it's already been kind of like ongoing, and then even that is problematic right now. So long story short, they do the bare ass minimum testing in the hospital system because insurance is dictating what they can do, not because they're idiots. Medical doctors are very well trained. They have amazing diagnostics. They have amazing technology. And I think that we need to use that technology when it's time to use it, and use functional medicine and naturopathic medicine when it's time to use it. So, so don't, like, if you're bleeding from your leg, don't come and see me and Dave. You know, if you get a dog bite in your leg or your foot or something, or ankle from a dog, please go to the ER. You know, let's be smart. So with that said, there can be a lot of things that can cause these things, and where people go wrong is they just get a TSH, and the range of TSH is a little high. So what that means is, in my book, if your TSH is above 2.5, then you probably have something else going on, and most likely have low thyroid function. But we don't know if it's autoimmune or if it's just non-autoimmune hypothyroid, low thyroid function. And that can cause weight gain, that can cause cold hands and feet, that can cause, like, you'll notice, well, it's harder for women because women are like tattooing eyebrows on their face now and penciling in the rest. But before you do that, ladies, if you have like a thinning of the outer third of your eyebrow, that's low thyroid. Dry skin, probably hard to tell if you're in a dry climate, but if you're using lotion, 300 days of the year, then maybe that could be low thyroid. Constipation, if you're using laxatives, whether they be laxative herbal teas or over-the-counter laxative pills to have a bowel movement, or need at least 1 or 2 cups of coffee to have a bowel movement, that could be low thyroid. So a lot of people today come to us with digestive issues and constipation, and then we find out that they have like a bacterial overgrowth or a fungal overgrowth, and their peristalsis, their intestines are not moving, things are not moving down and out, right? So thyroid helps you do that too. So if you're not balancing and correcting thyroid problems, and this goes beyond just taking medication. So that's the first part of my answer to your question. Excuse me.
Let me interject there, because
Yeah.
I a lot of times when I say, well, what thyroid labs, let me see them all, and I get just the standard TSH and T3. My experience is running those labs is not that expensive out of pocket either.
Right.
Where you're coming from as well?
Yeah, I mean, I use some direct lab testing, and I think for both, the highest price that I've found for both the antibodies tests it's like $33 to $40 for both of those, and then the rest of the test is probably another $35. So it's like, to get a complete thyroid panel, you're looking at like maybe $60 to $80 at most out of pocket, and we don't need to retest that like every week. It's like the most we're going to do is retest that again in 3 to 6 months. So this isn't something that you should be worried about, like, oh, I'm going to have to spend this again very soon. So that's right. Yeah, it's not, I think when it comes to diagnostics, the focus should really be on finding out what's wrong, not ordering every test under the sun. And then reverse T3, a lot of doctors like to test it, because if someone has fatigue and they're taking their active thyroid hormone T3 and they're dumping it into reverse T3, that can be part of the fatigue. And a lot of people have fatigue today and they don't even know it. They're just like, oh, I'm drinking like 3 cups of coffee. And then, Dave or I interview them, and it's like, oh, it's a triple shot latte mocha from Starbucks. Well, 3 of them. Yeah. Okay. That's not 3 cups of coffee. That's,
Right.
9 cups of coffee with a lot of sugar, and a great way to get diabetes and heart disease. So I'm not faulting the individual. We live in a world where it's like survive or, or don't. And I think a lot of us are just doing the best we can with the information we have. And I remember I first started seeing a naturopathic doctor 21 years ago. And I remember they were like, okay, you're going to eat whole foods. And this was before Whole Foods existed. And I was like, what are whole foods? Um, and, and I was pretty young. I was 17. So I was used to eating like pasta, steak, potatoes, um, French fries, you know, cake, pie, all the things, and looked at food from a basic nutrition point of view of like, this is just going to give me energy. And then I'm going to have energy. Why don't I feel good? You know, I'm eating all the things and I feel exhausted. So if that's you need to get a full diagnostic workup. And I would say, if there's a lot going on, you just need to prioritize like, okay, well, we need a full endocrine diagnostics first. If your hormones aren't working, your brain's not going to work, your intestines aren't going to work. There are receptors for our hormones in every cell, and most of these receptors are deep within our cell, right in basically the brain of the cell nucleus, if you will. So if that makes sense to you, how important hormones are. If your thyroid's not working, it's like the thermostat of your body. You're going to feel cold when you shouldn't feel cold. So maybe you can save money on your heating bill, by
Well, let me
optimizing your thyroid.
ask you this. So if I come in, if your client comes in and they have TSH, basic minimal level labs, and they are, showing you all the signs of hypothyroid, um, what are the consequences of not running those additional labs and running those antibody tests?
Yeah, so often what happens is people, like you say, they don't get the antibody tests and they go on for years, oftentimes years. And what can happen is the risk of not dealing with something like Hashimoto's thyroiditis is you can get thyroid cancer. So from a very conventional lens, from my research, the NIH is actually dumping more research right now, more research dollars, money, billions and billions of dollars into autoimmune diseases because they can become cancer. And it's harder to treat cancer um, than it is to kind of work, even though conventional medicine still doesn't know what to do with autoimmune disease, than it is to work with autoimmune disease early on. So if somebody has Hashimoto's and they come to me 1 to 2 years after having the symptoms, that's better than them coming to me 20 years later. And now it's like, oh, you might have thyroid cancer. And most women are getting thyroid cancer in their like golden years, age 20 to 45, 20 to 50. So those are the years, obviously none of us ever want to get cancer, but we don't want to be spending some of the best years of our life chronically ill. And usually what they do is they remove your thyroid gland when you have cancer, and then you're on thyroid medication the rest of your life. And I have some patients like that. And it wasn't their fault. It was usually environmental toxins. In Washington State, in central Washington, we have the Hannaford site. And there's been a lot of leakages of if you don't know about that site, it's a nuclear like sludge waste containment site. And it's leaked out into the rivers around there. It's leaked out other places. And it seems like every 3 to 5 years, there's an alert that there's been a leakage. So people who grew up around there, a lot of the women tend to have thyroid cancer. Also, going back further in time, way before I was alive, they used to have these X-ray things in pharmacies. So if you're listening and you remember this, you used to be able to go into a pharmacy and usually my patients would tell the story like they're waiting for their mom to get something in the pharmacy, and they had an X-ray thing that looked like a scale that you would step on today, and it would X-ray or send X-rays through your whole body, and then you could look at an image, I guess. And kids would just play on this thing while they're waiting for their parents. And what has happened for these people is my patients believe that, and I listen to my patients, I don't say, oh, that's impossible, because we do know that radiation affects the thyroid. So they believe that this was part of their like pathophysiology of why they got thyroid problems. What I see a lot of the time in Seattle, there's a lot of naturopathic doctors there because of Bastyr University, and Bastyr University has been there since the late 70s, and naturopathic doctors have been licensed in Washington State for 100 years. So what I see is doctors, my colleagues, unfortunately, some of them are not looking at root causes as much as I think they should. And some like maybe other practitioners, and they're giving like maybe a multivitamin, maybe selenomethionine, because selenium helps you with thyroid conversion. They're not looking at gut health. And maybe it's like zinc, selenium, vitamin D, and thyroid medication. So the issue with somebody who just gets Synthroid or levothyroxine prescription, which is one of the most commonly prescribed medications in the country right now. So that's Synthroid or levothyroxine, for those who don't know, is a prescription medication that your doctor can prescribe to you, and it is T4. So 15% of the adult population, or the population as a whole, has a problem genetically with converting T4 to T3. And where this conversion happens is it happens in your gut, it happens in your liver, happens in your kidneys, and it happens in the whole periphery. So peripheral blood everywhere in the body. So women have a issue with this enzyme. It's called a deiodinase. So it basically chops off one of the iodine groups, and from the T4 makes a T3. So women have a problem more than men with this conversion in the periphery. And I don't know why that is. It's genetic for women, but it's also across men. For men and women, 15% of the general population has a problem with this. So if you're getting T4, you may not, even if your gut is healthy, even if your kidneys are healthy and your liver, you may not be able to convert that thyroid medication. So you may need a thyroid medication that's both T4 and T3. So those are the mistakes that I see, and it happens all the time. I mean, it's happened for my family here in Montana. It's happened for my patients here in Montana and Washington State, and I'm sure it's happening across the country, everywhere else. And I think everybody's trying to do the best they can with what they have, but if you're not responding to Synthroid, you probably need a different medication. You probably could lower your medication if you improve your gut health, because that's where you're converting the medication. So things to think about.
There's a lot of intertwining in the body. Everybody wants to say, okay, it's just your heart, it's just your thyroid, it's just this. It doesn't work that way. Everything is interdependent. Like you said, the thyroid hormone receptors are on every tissue in the body. I mean, there's no way to isolate it. So that's the big mistake, the lab testing and not understanding if it's an autoimmune thyroid issue. What I see a lot of times is thyroid, TSH is high, Synthroid or levothyroxine's prescribed, TSH comes down, a year goes by, TSH goes back up the medication, it comes down, and there's that yo-yo there. But something in the background driving that, and that's the autoimmune. And I think the last estimate I saw was upwards of 60% of hypothyroid is estimated to be from autoimmune conditions. Is that what you're seeing as well?
Yeah, there's a lot of autoimmune disease out there today, and I'm seeing historically and statistically is mostly a female concern, like Hashimoto's thyroiditis, but I'm seeing it more in men. And men come to me thinking, oh, okay, you're the male testosterone expert in the area. We're going to come see you. And then their testosterone's actually good, for now anyway. And they have Hashimoto's that has never been diagnosed. And so those symptoms can overlay. So thyroid symptoms can mimic other hormone symptoms, and they can look like other things. So that's why you need somebody who knows what they're doing so they can check off these boxes. And yeah, it's on the rise. I mean, autoimmune disease is like a fire going across the country. It's just, if someone doesn't have something like autoimmune disease, it's kind of like, wow, okay, you're in a good spot, you know?
Yeah. Yes.
So
it's becoming more and more common. So that's the number one mistake. How about the number two mistake you see with thyroid? Already been I'll paint the picture for you. Diagnosed Hashimoto's hypothyroid.
So what a lot of people do is they don't look at root causes. So let's say you got your Synthroid on board. If you are taking thyroid medication and if you have Hashimoto's, and you're taking thyroid medication, you're not doing anything for the autoimmunity. You're just giving your body more thyroid hormone as your thyroid is being destroyed. So eventually you'll have no thyroid and you'll have to supplement 100% of your thyroid gland. Also, there's the issue of if you're taking thyroid medication long-term and you don't need to be taking it, your thyroid gland will atrophy as well. So you want to make sure that this is something you definitely need. And it's not like, oh, okay, either a misdiagnosis or it's actually Hashimoto's. And, maybe you do need that thyroid medication, but maybe you don't need as much. So they're not looking at root causes. Root causes could be things like gut health. Most of the time it's something with the gut. It could be that your adrenal glands are completely whacked out. So the adrenal glands are two like walnut size glands on top of your kidneys. So if you're not checking your adrenal health, that is definitely something that needs to be looked at.
Let's take a step back though for real quick. So when we're talking gut health, we just throw that term around pretty broadly. You're talking dysbiosis, the bacteria are imbalanced. You're talking leaky gut.
Yes, all those things. It could be leaky gut, which is where your small intestine and enterocytes have either a gap between the two cells or basically are split in half. And then your food particles are getting into your blood and then you're getting more food allergies. And maybe you've already kind of been backed up into a corner, so to speak, where you can't digest or consume certain foods beyond what you used to. And then it's like, okay, I can eat 5 things, without having any indigestion or digestive issues like diarrhea, constipation, bloating, gas. A lot of women today have bloating and they think it's hormonal. It could be female hormone imbalance, but oftentimes it's some dysbiosis. I call it SIMO. Other people call it SIBO. So small intestinal microbial overgrowth, which encompasses parasites, protozoa parasites, pathogenic bacterium, and different things like candida, enterocandidiasis in the gut.
So I'll interject here, and I know you and I use the same type of testing.
Yep.
What do you do for that, to figure that out, the SIMO?
Yeah. So I am a big proponent of the GI MAP stool test. It's qPCR testing. What that means is it's genetic testing. So it's not a stool culture like a lot of tests. It's going to, if it's there, it'll find it, assuming that the collection was done correctly. And the issue with culture is like things can be cultured and they cannot grow if they're there, or they can grow if they're not there that much. So there can be some like non-specificity with the cultures. I just haven't found. I used to do a different lab test and I just knew that there was more going on, and I would only find bacteria and candida. And I knew that there was like something else going on because the patient had such severe symptoms. So we are finding like protozoa. I found for people with Hashimoto's like hookworm,
Yep.
I've found other worms. I've found protozoa. A lot of men with, I know we're not talking about it in this talk right now, but a lot of men who have been diagnosed with Crohn's disease have protozoa for years, and you don't have to travel out of country to get these protozoa or worms. You can just be like eating something that wasn't cooked enough. You could be eating sushi, or somebody who made your food just didn't wash their hands well enough. I'm not trying to scare people away from eating food. We want to have a diverse diet, but there's definitely, it's definitely happening. I mean, it's a myth that in the United States that we have no parasites and things. All you have to do is go camping. You can get Giardia. So that's a good example. If you didn't like purify your water correctly or boil it, you can get these infections. So, and we can remove them with different herbs and different things that we have on board. And those formulations are effective. Usually it's like 1 to 3 month treatment, and then another 3 to 12 months to like heal the gut, depending on how screwed up the person's gut is. Some people, it takes like 2 years if they're not doing the lifestyle things.
Along with good dietary intervention and lifestyle.
Yes.
Yeah, absolutely.
Yeah. I mean, lifestyle is like the foundation. So I grew up building houses with my dad and watching him build houses before I could, probably walk. And if you don't pour the foundation right, if you don't get the foundation right of the home, like if you don't do the lifestyle stuff, none of this other stuff matters, including thyroid medication. So if you're getting less than 7.5 hours of sleep a night, maybe you could lower your thyroid medication just by getting 8 hours of sleep a night, right? And then your thyroid wouldn't atrophy as much. So these things we think are like little bitty things that don't matter that much. And it's like, oh, I got to work more to make more money. And under all this stress. Well, if you slept more, your reaction time would be faster. You would get more done. You would be more productive. You would have less chance of dementia, less chance of like low thyroid, low testosterone, etc. Less chance of autoimmunity. Gut dysbiosis goes up when we don't sleep. So I'm working on my sleep. I'm asking my patients to work on improving their sleep or make it a priority. Water and sleep should be like the top 2 things.
Absolutely.
Hydration and sleep. And then after that, it's like, okay, what are we going to eat? There's this, I mean, I honestly think it's a stupid debate, but there's these nutritional debates out there right now where it's like keto, carnivore, vegan, plant-based, paleo. And it's like, most people, frankly, just aren't even eating real food,
Yeah.
Like, let's just eat real food. If you're eating whole wheat bread and you're eating mostly vegetables and like palm-sized serving of meat, and you can digest cheese and you're eating that, like, and you're eating fruits, good. Like, that's a great start, and try to eat mostly organic. And then we can get, like, when you work with Dave or I or someone like us, then you can get in the nuance of like, well, is a keto diet okay for me? Like, what's the best thing for me? And I've had, and I'm sure you can echo this too, Dave, I've had patients come in and we do some of these advanced lab tests we have, and it's like, hey man, like your gallbladder can't even digest fats because you're under so much stress. Your mitochondria can't even uptake fatty acids because you don't have enough acetyl-carnitine in your diet or in your body. So that's why you're tired. Like, you can't even get access to the nutrition you're getting. So
Putting it in, but not firing. Yeah.
yeah, the engine's not able to uptake the fuel. So that I think at the core of autoimmunity is gut dysbiosis and mitochondrial dysfunction, so cellular breakdown, where the cells just aren't able to use the energy the way that we learn in school that they're supposed to. So, and most people today, I think, are in denial of how sick they are, because I've heard this thousands of times probably by now. Their doctors said, hey, like, you're just getting old, and they're 35 or they're 45. And it's like, well, there's people living over 100.
That is the most frustrating statement that I hear.
Yeah.
Across the board. That's normal for your age.
Right.
You know, it just that amazes me. That amazes me. So here,
Yep.
I'm going to give you one last question that we're going to answer a few questions. So somebody who has, and I'm going to say specifically hypothyroid, okay, and they're doing what they're supposed to be doing in their minds, taking their medication. What's one thing they don't realize that they should be doing? You know, they've got the diagnosis, and let's even go further, and they've been diagnosed with Hashimoto's, and they're taking their medication. What's missing from that?
Yeah. So what's missing from that? I mean, I would say that's like there's something really wrong with the entire systems at large. So why is your immune system not recognizing your thyroid as part of your body? Because that's autoimmunity, where self is attacking self. So your immune system is responding and attacking your thyroid. Why is it doing that? That question has not been answered at a very basic and more complex level. So without getting too like nerding out on the details, thyroid medication does not treat autoimmunity. End of story. Thyroid medication is replacing what autoimmunity has been destroying. So if you're just taking thyroid medication and you have Hashimoto's, there's been nothing to prevent this from becoming thyroid cancer. There's nothing that has been done to prevent this from becoming another autoimmune disease. Because if you have one autoimmune disease, the risk is that you're going to get another one. And most likely for most people, that's going to be for women, like rheumatoid arthritis is the number one. It could be like Crohn's disease, more ulcerative colitis or Crohn's, or type 1 diabetes is more common in men. So the issue with that is like someone could get their colon resected. Well, if you want to be able to take a poop on a toilet and not into a colostomy bag and not have to get your colon removed, and I'm not blaming people if this has happened to you. I've seen it happen to my doctor colleagues, and it's horrible. But that's what happens. That's just frankly what happens. So, or if you don't want to spend $6,000 to $7,000 a month on Humira, which is used for Crohn's and rheumatoid arthritis, then getting to the root cause is what needs to happen. So that would be looking at gut health. That would be looking at mitochondrial health. That would be saying, okay, what things can we use to balance the immune system and then in your own life, in your own mindset, whether you need to work with a therapist or a health coach or both, what am I responding to in my daily environment, whether there's been a physical or psycho-emotional trauma in your past that could have potentially triggered this, or environmental toxin. I already talked about that. That could be part of this autoimmunity. So we know that the immune system has like this danger response, that it responds to danger. So the theory, this comes from Isabella Wentz, who's the thyroid pharmacist. She has several books and a blog, that women are in some ways in our culture, you could argue, under more social stresses and feel less safe in more environments than men do. Like, for example, recently in Seattle, there's a shooting, and I've been in that area many times. And I walked down that street many times because it's in downtown Seattle, and that's where you take the buses. And I would not recommend any female in daylight walk down that street. And I'm still watching my back, but as men, in this culture, we have, I think, feel a little bit less threatened in a lot of situations. So because of that, women, Isabella Wentz postulates and theorizes that women have more autoimmunity because of that. So if there's been these traumas, then working with somebody, whether they can work on that trauma, whatever that may be, and it doesn't have to be something extreme. It could be something extreme enough for you that triggered this. So for some people, it's divorce. And I see this a lot with men with low testosterone. There was a divorce or there's a major breakup. They had to sell their house, change careers. These can be metabolized in your nervous system as a trauma. So maybe take that into account, and maybe that's your root cause. So I think that's the issue. People are just not getting, frankly, to the root cause. Like, what is really going on here and why?
Absolutely. So let's cover something. Hypothyroid, Hashimoto's, dietary. My number one thing I say right off the bat is you got to stop gluten. Yeah,
Yes.
stop it right now. And that's been shown in the literature over and over and over. That needs to be done. But what else would you tell somebody? Dietary wise.
Yeah. So in this country, and I have a podcast for anyone who wants to listen to it. It's on iTunes. It's on my website, on Spotify and other platforms. It's called the Dr. Madeira Show. Madeira spelled like the wine, for those of you who need to know the spelling. But I just interviewed an organic farmer here in Montana, and we talked about this. So most major crops in the United States have pesticides and or herbicides on them. And the herbicide that most people are aware of now is Roundup, glyphosate, which is carcinogenic. It changes the gut microbiome at the genetic level. And there's a PhD researcher at MIT who's done research on this. So if you're like the engineer mind where you're like, I need the data, where's the data? Go there. So we have that information. And Roundup is carcinogenic. I'm in Montana. People are still crop dusting all over the country. In Montana, they're still spraying. They're spraying wheat. There's GMO soy, so avoid soy, avoid wheat. Gluten's in wheat. That we've made crops more glutinous and specific glutens that are more inflammatory for bakers over the years. So they've actually been kind of quote unquote engineered to have more of this gluten than they did maybe 100 years ago.
Yes.
So I usually tell people like eat what your grandparents ate, or what if you're older than age 70, eat what your grandparents ate. So my grandparents, even in Philadelphia in the 90s, had a little garden in the back of their apartment. And I don't remember until maybe the late 90s, organic really being a thing. It was just kind of like, these are vegetables. And no one in my family sprayed them. It was like, here's the stuff out of our garden we eat, and then we'll go buy a steak and some potatoes. So grains in the United States, unless you're buying organic, you got to avoid gluten, but I would avoid grains. I would avoid soy, especially for men and for women, because it can potentiate like estrogen if you're estrogen dominant already. I would avoid hops, and hops is in beer, so don't kill the messenger. But sorry, guys and ladies, if you like IPAs, hops is sprayed before they harvest it with Roundup, with glyphosate. And then the wheat in your beer, the barley, is also sprayed. So you're getting like double dose. Also, if you're going to drink wine, make sure it's organic. And then like cut out all soda. So basically grain-free, soy-free. You could try like an autoimmune paleo diet. But what I see happens in people in those scenarios is they get kind of like food phobias. And then after a month or two, it's like, okay, it's time for you to introduce a food a week. Let's try rice, and I have patients that over the years that a year later, they're like, I don't know what to eat. And it's like, there's been instruction to do reintroduction over a year ago. There's been instruction to try different things, try sweet potato, try white potatoes, red potatoes, mix it up. We need to have diversity in our diet and not be food phobic, but be educated enough to know these are not foods anymore. These are poisons.
So let me put a little spin on that, because I had this question come in. A child diagnosed with hypothyroidism, and I'll assume Hashimoto's as an autoimmune. Same recommendations go?
Yes, and I would say there needs to be more kind of freedom and diversity. Um, so looking at what is in the diet, all kids should be eating organic. There's so many toxins in foods that are leading to neurodegenerative conditions like casein free, gluten free, a must, especially if there's any issues with like neurodegenerative stuff around autism. So there's a lot of research on that. But for most autoimmune conditions, you want to basically be, most of the plate should be vegetables and fresh vegetables, eat a rainbow. The nightshade family for some people with autoimmune diseases is problematic, for other people not. Um, I have some autoimmunity going on for myself, and it's basically like not a problem for me right now. But I found that if in the last 3 months, I had a soup that had like a pepper paste in it. So peppers are in the nightshade family. And I'm fine with eating like raw peppers in a salad in moderation. But if I have a ton of peppers or like a pepper paste, I don't digest that well. And I started getting like some joint pains in my hands. So that's a very concentrated thing. Also, leftovers have more histamine in them. So if you have issues with histamine foods, this is more nuanced. Work with a practitioner. Like, don't try to do all this on your own. It's very stressful to do it on your own. But if you're working with a practitioner and you're like, oh, well, I'm responding to leftovers, maybe that's histamine. But kids should be like, make it fun. You know, they should be eating fruit. They should organic fruits. They should be eating organic vegetables. Eat a rainbow. Try different things. Get creative. You can still make like sweet potato French fries. Just bake them.
Right.
So I think we've kind of like freaked out about the food a little bit too much. And then when we freak out, we self-sabotage and it's like, oh, I'm going to go back to eating what I ate before. And then we feel horrible. Um, but if you can make it fun, make it creative, like involve your kids in some of the cooking and the preparation, and then they can feel like more connected to the food. Maybe watch some documentaries if you're not near farms or you don't know your farmer. If you have organic farmers near you or like a community supportive agriculture,
We do. Yes.
yeah,
Yeah.
yeah, do those things. Like go to the farms, meet the farmer. Uh, in the fall, like go do the farm rides and get the pumpkins and all that stuff, and like meet those people and go to the farmers markets. And there was this whole movement of like the slow food nation, kind of the opposite of fast food, and to go to farmers markets. And now I think people just go to farmers markets and they just call it like grocery shopping again. But um, this is like how everything used to be, folks.
Right.
Whole fast food stuff is new, you know, since the 50s.
Told your great grandparents, they
Yeah.
they would be confused with what you're doing right now and what's going on out there. They would be more what we've just been talking about. This would be the norm for them, what they would have normally done. Yeah. Yeah, absolutely. So, you know, we've covered a lot here, but is there anything I haven't asked you about thyroid and thyroid issues that you really, it's burning and you need to let us know about? Need to let the people listening know about.
Yeah, I mean, there's definitely certain nutrient deficiencies you want to have on board, and you want to get high quality, like pharmaceutical grade, third party tested nutrient supplements. So not just something. Please don't buy supplements off of Amazon. They're counterfeit. I live and work in Seattle, and Amazon's headquarters in Seattle, and I have friends who work there, and I've talked to them about this. They can't control it. So just, you know, like use Amazon for like your books and things that you don't consume or put on your skin. But yeah, so you want to find out what those nutrient deficiencies are. Could be vitamin D, could be zinc, magnesium, could be other things, other trace minerals. The thyroid uses a lot of selenium. The thyroid needs zinc. You need to see if you need, a lot of people are vitamin D deficient, but you don't want to overdose. So I'm not a big fan of people just trying to self-treat and order labs on their own if that's legal in your home state. I have tried to be my own doctor, and I have a doctor that I hired, and I pay them to kind of guide me. So, and I'm saying that as a doctor. So if I'm doing it, then if you're not a doctor, then I believe you should be hiring a doctor too, because otherwise you end up with like a cocktail of supplements.
You come in with blinders as well.
Yeah.
When you're dealing with yourself.
Yep.
Yep, absolutely. Well, Dr. Sam, I'm going to thank you very much. I'm going to put this disclaimer out there. Please don't take and run with this advice off on some tangent. We were giving general, broad-based information about hypothyroid, Hashimoto's, hyperthyroid. Your specific situation is always controlling, and you need to know what that is, and you need to delve into that with somebody who's qualified. So I'm going to post in the link below. I'll get a link from you for the Dr. Madeira podcast. It's a great show. I listened to it. I know I've been on it. Wonderful time. I think I even posted it in this group the last time I was on. So if you have any further comments or questions, we can't get into specific questions. I will post the lab testing in a document like I did 2 weeks ago with our previous interview. And then you can just reference it, what labs you should have. Dr. Sam, do you have any parting words for everybody?
I guess if you have more questions, I do have like a free downloadable document on Hashimoto's specifically on my website at apollohealthclinic.com. So you can go there and download that. There's also some free documents on like andropause for low testosterone, which can happen for men at any age. Also for women or wives who want to know more about testosterone, you can also download that document. And then there's a perimenopause free downloadable document for women who are concerned about perimenopause.
And you shoot me that link, and I will post it as well.
Okay, will do.
Make it easy for everybody to get. Thank you very much for your time. Enjoy Montana.
Thank you.
It's got to be cold there. So everybody just remember, you are just one change away from better health. And again, thank you, Dr. Sam. Everybody have a wonderful day.